Hello everyone, welcome to Opinion Bihar. Today we'll be discussing the ongoing pandemic of COVID-19, which is commonly known as the coronavirus. We will be mostly focusing on its effect on Bihar and the state's capacity and plans to deal with this issue. We will also try and give essential information regarding COVID-19 itself and how to better protect ourselves and our community. So, first of all, let us discuss what a pandemic is. Pandemic is basically a global outbreak of disease that is not restricted by geographical limitations or even seasonal cycles. For example, malaria is restricted by seasonal cycle. However, a pandemic like COVID-19 is not. Other similar cases of pandemic can be seen throughout the history. Spanish flu, for example, in 1918 was a pandemic that killed more than 20 million people. Recently, the HIV/AIDS pandemic of the early 2000s was very famous. However, unlike HIV/AIDS, which could be prevented easily by the use of condoms and other sexual protections, COVID-19 is a much more serious and complex case. COVID-19 or coronavirus is a single-stranded RNA virus. The risk groups include older aged people above 65 years of age and the immunocompromised patients. It can be transmitted by respiratory droplets and secretions as well as saliva, which basically means coughing, sneezing, or even spit, is what transfers the virus from one person to another. It starts by showing the symptoms within 2 to 12 days. Thus, the isolation of 14 days is required for anyone who might be infected. The signs and symptoms of coronavirus include fever, cough, shortness of breath, fatigue, which basically means a person can get easily tired, or even a loss of taste and breath. If one of these signs are being shown by one of your relatives or you should immediately contact health official. Bihar is the third largest state by population and the 12th largest by territory. However, it remains the state with the weakest health care facilities, despite considerable financial influx into the health system by the state of Bihar and the government of India. This data, taken from the State Health Society of Bihar, shows exactly how dire the situation of health in Bihar is, and how much more frightening this pandemic can be if not controlled promptly. As of 7th May 2020, Bihar has had 350 number of positive cases, among whom 188 have fully recovered and 4 have perished. As shown in this map of India, Bihar has not been hit as hard as some of the other states in the country have been. However, the potential of this pandemic spreading like wildfire is the highest in Bihar owing to its high population and weak healthcare facilities. The number of active cases continue to rise in the state, which is indicative that the lockdown has not been strictly followed in Bihar. While a number of states like Telangana and Kerala have started a phase of recovery, Bihar has yet to boast of such a feat. The Union Health Ministry has recently stated that 5 districts of Bihar are the COVID-19 red zones, including Gaya, Buxar, Rohtas, Mugur, and Patna. It is important that we know how to protect ourselves from the COVID-19. Some of the easy ways that can be implemented at home itself include washing our hands regularly with soap and water, hand wash, or any alcohol containing hand sanitizer. Cover your mouth and nose while sneezing and coughing, preferably with a tissue that can be disposed after a single use. Avoid close contact with anyone who has cold or flu-like symptoms. If you have fever, cough, difficulty in breathing, seek medical help early. Elderly people and immunocompromised patients, which include people with diabetes mellitus, with high blood pressure, should take extra care of themselves. Also, parents should take extra care of the children in the family. I would also like to request all the viewers to stay home, stay safe, and to follow all the guidelines set forth by the Government of India and the Government of Bihar.
और समाज से मुझे ये बोलना है कि जो सूचनाएं हमारा सरकार ने हमको दिया है पूर्ण रीति से उसको पालन कीजिएगा और जितना हो सके बाहर न निकले। और मैं सबसे बड़ा मेरा ये बोलना चाहता हूँ कि खुदा पर भरोसा रखिए क्योंकि वही हमको चंगाई करता है।
Thank you for watching this video. Please like, comment and subscribe. We shall endeavor to post more videos related to Bihar, its rich history and any current issues that needs to be discussed. All the informations used have been taken from the official website of the Ministry of Health and Family Welfare, Government of India.